friends, welcome back to my channel once again. Today the topic is teeth and systematic disorders, and we will be studying this topic in three under subtopics, that is enamel hypoplasia, periodontal diseases and specific periodontal diseases. Now, why we are studying this topic, why it is important? Because see, there are some systematic disorders which can associate with some teeth disorders. Okay, or there can be some teeth disorders that can correlate or that are present with some systematic disorders. So we can assume that if this systematic disorder is present, so there can be that teeth disorder. Okay, or if a teeth disorder is present, then we can assume that this systematic disorder must have been present in this patient. So we will be studying the enamel hypoplasia, periodontal diseases and specific periodontal diseases. Starting with the enamel hypoplasia, the names only tells about the enamel hypoplasia, means enamel is underdeveloped, the tissue have not developed fully, so it is enamel hypoplasia. So it can occur when there is disturbance in calcium and phosphate metabolism, when there is a disturbance in calcium and phosphate metabolism, or if there is a prolonged hypocalcemic state, like in case of rickets, malabsorption, hypoparathyroidism and celiac diseases. So if a patient with enamel hypoplasia, we see a patient with enamel hypoplasia, okay, we can assume that it can be due to rickets, osteomalacia, hypoparathyroidism or malabsorption. Or if there is a patient with malabsorption and any other diseases I told you, like rickets and all, we can assume that the patient might have enamel hypoplasia. Okay, so teeth and the systematic disorders. So this teeth disorder is associated with this systematic disorders. Okay, now there is the alteration in structure of crown, and it commonly involves primary and permanent teeth. In case of enamel hypoplasia, there will be alteration in the crown, okay, in the structure of crown, and it can also be due to, like, in premature birth, when there is premature birth and all and high fever, it can also cause enamel hypoplasia. The cause can be, if there is a calcium phosphate metabolism disturbance, or prolonged hypocalcemic states like malabsorption, rickets, etc. And in celiac diseases, or if there is premature birth, or there is like high fever, these all can lead to enamel hypoplasia. Now, in case of enamel hypoplasia, there are some other alteration or case. There can be some other cases, like first of all, the enamel hypoplasia. I told you that it can be associated with the conditions or diseases like rickets, osteomalacia, celiac diseases, hypoparathyroidism. So if there is enamel hypoplasia plus there is discoloration, that it can be due to tetracycline therapy during childhood, pregnancy or infancy, or up to 8 years of childhood. Okay, then enamel discoloration. If there is enamel discoloration, it can be dental fluorosis. Okay, if there are large teeth, it can be due to diabetes, or it can be maternal hypothyroidism. If there is loss of deciduous teeth, it can be due to Down syndrome. Okay, trisomy 21, or it can be due to juvenile hypophosphatemia. Now, if there is hypodontia, then it can be due, the disease can be ectodermal dysplasia. So learn this, okay? Next one is the periodontal diseases. Periodontal diseases means the diseases of periodontal ligaments. So the first we study under periodontal diseases is periodontitis. Periodontitis means the infection of periodontal ligament. So how we will define this? It is a chronic destructive It is a chronic destructive periodontal disease. Okay, it is a chronic destructive periodontal disease which leads to the loss of teeth during third to fourth decade of life, like dental caries. In my other video, I talked about diseases of teeth. In that, I told you that if there is dental caries and we are not treating the dental carie, it may lead to pulpitis, apical granuloma, cyst, abscess, or matlab anything. So, if the dental caries is not treated, it can also lead to periodontitis. So the initial event in periodontitis is gingivitis. Okay, first the initial event there will be gingivitis. Now it will spread. Okay, it will spread slowly to the alveolar bone and periodontal ligament. Okay, the periodontal ligament means the ligament between the teeth and the bone. Okay, so the infection has spread between the teeth and bone. It will ultimately cause the resorption of bone and there will be loosening of teeth. Okay, there, there will be loss of attachment of periodontal ligament to the bone. It will lead to, if there is a loss of attachment in two things, then there will be a formation of gap. We can say pocket formation in case of periodontitis. There will be a pocket formation, and if a pocket is there, now when we will be eating something or anything or saliva, they will accumulate in this pocket. Okay, and there will be infection. So when we will probe in these gingival margins, there will be bleeding. Okay, so which is known as, there will be pus formation, presence of pus. Okay, which is known as pyorrhea. Pyorrhea. There will be pus formation. When we will probe in the gingival margins, there will be bleeding and there will be pus will come out, that is known as pyorrhea. Okay, now the bone has lost the attachment. Now ultimately, with the progression of infection, there will be loss of attachment of teeth to the bone. Okay, and the periodontal pocket which has been there, it can also deepen. Okay, with further closes the orifice, the opening जो होती है वो close हो जाएगी and it can lead to the abscess formation, periodontal abscess. जो पस वहाँ बनी है वो एक्सक्यूड नहीं हो पाएगी, बाहर नहीं निकल पाएगी, उसकी एग्जिट जो है वो बंद हो गई है. So there will be periodontal abscess. Okay, advanced bone loss, free mobility of tooth, recurrent abscess formation carry poor prognosis of teeth. Hence, teeth extraction is usual treatment in this case. So there is advanced bone loss, mobility, tooth is free of bone. Okay, so the extraction is the only treatment in these type of cases. Okay, so we have studied about the periodontitis. So what can be the predisposing, or we can say local risk factors? What are those local risk factors which can lead to periodontitis? That is first one, the most common, poor oral dental hygiene. If there is poor dental hygiene, it obviously can cause any of mouth disease. Okay, so second one is calculus. If there is oral dental hygiene is poor, it can lead to calculus formation and periodontitis. Down syndrome, overextended fillings due to if the fillings are overextended, so there will be a permanent or local irritation effect. That irritating effect can lead to periodontitis. Oral contraceptives can also lead to periodontitis. Then we have occlusal trauma. Any trauma had occurred, like or due to grinding of teeth, clenching of teeth. Okay, and the last one is idiopathic hereditary familial fibromatosis. So these are the local risk factors. So there are main 6 systematic risk factors we have to remember in case of periodontitis. First is neutropenia. In case of immunodeficiency states, tooth impaction, pregnancy, diabetes mellitus, and dilantin use for epilepsy. Next is specific periodontal diseases. In this topic, we will be studying about acute necrotizing ulcer gingivitis, chronic gingivitis and periodontitis, desquamous gingivitis, gum hypertrophy or gum bleeding, epulis and, and gingival ulceration. So specific periodontal diseases contains all these types of cases. Okay, first we will start with acute necrotizing ulcerative gingivitis. So there is necrotizing also, there is ulcers also, and there will be gingivitis also. Okay, so this is also known as Vincent's infection or trench mouth. Vincent infection or trench mouth. What happens in this? The main cause of this is fusiform spirochetes and are characterized with tender gums with bleed on pressure. There will be tenderness in the gums and they will bleed. If we will apply the pressure on it, they will bleed. Okay, there is gingival necrosis and ulceration, plus there will be halitosis, that is foul breath. Okay, so the pathognomic signs of acute necrotizing ulcerative gingivitis is there will be necrotizing gingivitis and there will be ulcers plus foul breath. Okay, and there is regional lymphadenopathy. The clinical evidence suggests that it is mainly due to psychosomatic disturbance. Okay. Second is chronic gingivitis periodontitis. What is this? Few minutes ago, we studied periodontitis. What happens in periodontitis? Ultimately, the result is there is loosening of teeth. Okay, so in this, there will be loosening of teeth with reduction in gingiva, with recedes gingiva gum margins, we can say. Okay, a calculus may be seen as a hard cream colored deposit on the teeth. In case of chronic gingivitis, there can be the deposition of cream like colored deposition on tooth. Okay, which is a predisposed to infection. It means if we will not treat that, it will lead to infection, further infection. Okay, so the bacteria mainly causing chronic gingivitis and periodontitis is Streptococcus viridans. Okay, and it may cause subacute endocarditis in the patient with congenital or acquired valvular heart disease, and also have the patient having valve prosthesis. So if we know, if we see a patient with chronic gingivitis and periodontitis, we can assume that the patient is a heart disease, the patient is or a patient has a valve prosthesis. Okay, and if there is a patient with a valve prosthesis, then he or she is at a higher risk of having chronic gingivitis and periodontitis. So next comes desquamatus gingivitis. Gingivitis. Remember that it is caused by lichen planus and mucous membrane pemphigoid. We can relate them squamous and planus. Okay, like lichen planus, squamous and planus. So, and the diagnosis we have to do a biopsy. Okay, the clinical description is there will be smooth red and atrophic gingiva. Okay, smooth red and atrophic gingiva. Gum hypertrophy. As the name suggests, there will be hypertrophy of gum, also known as gum bleeding. Normal healthy gums are of pink masses. Okay, they are pink masses which are firmly attached to the teeth. But the gum may be involved in many systematic disorders, like if we see a firm hypertrophic gums. Okay, if we see a firm hypertrophic gum, it can be due to cyclosporin line therapy. Okay, if we see a soft hemorrhagic gums, it can be due to scurvy, like they are soft and they are hemorrhagic. Next is hypertrophic plus hemorrhagic. They are hypertrophic plus they are hemorrhagic. They can be due to thrombocytopenic purpura and acute leukemia. If we see a spongy and hemorrhagic bluish gums, it can be due to cyanotic heart diseases. And if there are stick blue lines on the gums, they can be due to chronic lead, bismuth or mercury poisoning. So if a patient's gums are like they have blue lines, okay, on the gum, we can know that the patient may have a chronic poisoning of lead, bismuth or mercury. Next is epulis. Epulis is also known as pyogenic granuloma. It is localized gingival enlargement. It is like a tumor. Localized gingival enlargement. It is like a tumor mass originating on interdental papilla. Interdental papilla पे एक ट्यूमर लाइक मास ओरिजिनेट होता है. It is red, soft and bleeds on pressure. It is red, soft and bleeds on pressure. This is most common during pregnancy, so it is also known as pregnancy tumor. Next is the last one is gingival ulceration. There will be ulceration. It is mainly due to the ill-fitting denture or any trauma or due to the carcinoma. So we have studied all the periodontal teeth and systematic disorders. So what is the clinical significance? What is the clinical significance of periodontal diseases? First of all, the these are the periapical lesions or periodontal diseases provide a potential source of infection which may spread to other sites also. Okay, they provide a potential sites or potential source which due to which it can spread to other sites also. Second and most important, like if a patient with inflamed teeth, okay, if there is inflammation and if we do a simple massage on that inflammation, it will demonstrate that there is presence of bacteria. So if a patient is immunocompromised or with like any other disease, it can lead to severe infection or subacute bacterial endocarditis. This is important. It can lead to subacute bacterial endocarditis. Okay, so like in patients with rheumatic heart diseases, if we are doing a tooth extraction, it can lead to subacute bacterial endocarditis. It can lead to further infection. Okay, so a prophylactic antibiotic therapy is necessary in such situation. This is a warning, like we can't do extraction or any other procedure in the patients with rheumatic heart disease or rheumatic heart fever or immunocompromised patient. First of all, we have to give a prior prophylactic antibiotic therapy so we can avoid the chances or risk of subacute endocarditis. So this was all about teeth and systematic disorders. We studied it: enamel hypoplasia, periodontal diseases and specific periodontal diseases, and clinical significance. The clinical significance is important that periodontal diseases is a potential source, okay, which can lead the infection to spread to other sites also. And we can do a procedure in a patient with rheumatic heart diseases and fever or immunocompromised patient. We have to give a prior antibiotic therapy, then we so due to reduce the risk of subacute endocarditis. Okay, so thank you for watching my video. Next video will upload it soon.